Well, let's now turn to Europe, where more and more countries are easing COVID restrictions following a drop in the case numbers. It's a relief for businesses, especially in the hardest hit sectors. But many fear that too great a relaxation might undo the achievements of the months-long shutdown measures. For more, we're joined by DW correspondent Nicole Frolich, who joins us from Berlin. Thank you so much for joining us, Nicole. So tell us, restrictions are being lifted in many places, but life is not yet back to normal, is it?
Not at all. What we're seeing across the board really are baby steps. There is a great awareness of how volatile the situation is and the trauma of the past months, not only the devastating human costs of the pandemic, but also the psychological damage and the social rift that have come out of this crisis have decision makers treading very carefully. This week, we're seeing a very slight easing of curfew rules in Italy. France is winding down its third national lockdown. Greece just recently dropped quarantine mandates for foreign travelers. And England is proceeding with gradual reopening for now, that is, because there are worries about an increasing number of people becoming infected with the coronavirus variant first detected in India. Here in Germany, the situation very much depends on where you are. Regions can ease restrictions if the infection rate drops and stabilizes, something that's just happened here in the capital, Berlin, but will have to go back into lockdown if numbers rise again. So citizens are being urged not to get carried away with their new freedoms, keep up social distancing and hygiene measures to make sure this third wave of the virus really is the last.
Now, Germany's also announced a shift in its vaccination strategy. What's that about?
Well, on Monday, Germany's health minister announced that starting in June, every adult over the age of 16 will be eligible to get vaccinated. That means that the current priority list, putting the vulnerable and exposed ahead in the queue, will no longer apply. Vaccines will be given out on a first-come, first-served basis to anyone who wants them, but that sounds a lot easier than it actually is. A number of states had already ditched prioritization to speed up the process, but that has often ended in chaos, with demand drastically exceeding supply, doctors' offices overwhelmed with requests, or people waiting for hours just to be sent home unvaccinated. Vaccination centers here in Berlin currently have a wait list until the end of July. I checked this morning, so infrastructure processes and vaccine availability will have to be considerably improved for everybody to actually be able to get a shot when they want one.